The way we strengthen bone is we got to load the bone. So we will do things like gentle bicep curls. We will do pull downs. Yes, we use bands, but I like to start using 2, 3, 4, 5 pound weights. And those weights make a difference with time. It might take 1 or 2 years, but if the next time my patient has a DEXA scan and there is no change, I consider that progress. Hi, I'm Dr. Wendy, your favorite physical therapist, and I talk about women's health all the time. And right now I'm talking about osteoporosis because prevention is better than treatment. So if I have a patient who comes to my clinic and she is having degenerative, bony, osteoporotic changes in her arms, we start talking about something ridiculously simple, such as wall push-ups and bicep curls. If I have a patient who is having lower extremity or low back degenerative changes, we start to talk about walking because those ground reaction forces coming up through the leg helps develop bone in the spine and hips. The downside with swimming is it is not a weight-bearing activity. As much as I love swimming, especially if you are a patient who has a connective tissue disorder, swimming does not have weight-bearing. So if you have a tendency towards osteoporosis or osteopenia, that won't be enough. Because according to Wolff's Law, if I want to make bone grow, I have to stress the bone, which means walking, hitting the pavement, cycling, lifting weights. And if you've been with me long enough, you know how I feel. Every woman needs to be lifting weights 3 times a week to prevent sarcopenia, which is muscle loss. But now I'm telling you, you need to move and walk and lift weights so your bones don't become brittle snips. Hit the plus sign and follow for more women's health and wellness tips. You got a diagnosis of osteoporosis, but now what do you do to build your bone?